Life really is a wonderful journey, and that's why we are here. Community Palliative Care Service, celebrating life.
Chum House is part of the palliative care program, so it's a place that palliative patients can come for the day out. So it gets people out of the house instead of just stuck at home. Meet other people who are in a similar situation, and it's always good to have someone to bounce some of the thoughts that you're having. What we're here for, we're here to support the patients and the carers.
I'm Alice and I'm presently the manager at the Hospice in Bendigo, which is the 10-bedded unit, and we provide symptom management and end-of-life care where patients may be admitted to die. We are often referred patients by the community team. Patients might be struggling, so they'll come along and stay with us in the hospice for a short period of time to get on top of those symptoms and get them back home if that's where they choose to be. We have a team of very specialised nurses here, and often patients are quite surprised after a couple of days of how friendly and homely and relaxing the hospice actually is.
Hello, I'm Judy. I've worked on the Hospice Unit for about 10 years and I just love it. We have a lovely team of nurses and we all get on really well together. We have relatives comment on what a nice quiet environment the Hospice Unit is, and they're thankful that they've had the chance to spend time with their loved ones. Once their symptoms have been managed, we then plan their discharge and they go back out into community palliative care service.
Hi, I'm Ruth. I'm a palliative care nurse consultant with Bendigo Health. Most of the time our visits would be generally around about an hour, and we do talk about death and dying, but we also talk about getting on with life and making the most of each day. Yeah, they do look forward to us coming. We don't want to be creating a situation where they rely heavily on us, because at the end of the day, it's, they're in control. We want to make them in control. It's not us taking over. Sometimes we get responses like, oh, they're here to put us into hospital or to a nursing home. We're not there to do that at all. Our role is to make people as independent and to stay at home. That's our role.
We have a walkers group, which is a really vibrant walking experience that we do on a weekly basis, where bereaved people, carers of people who have died, are invited to walk with us. People have overcome, and my job is to understand the challenges that people have experienced and overcome in their lives previously, because all of those strengths and resources still remain. And often I see that humour is one important way that people overcome adversity and overcome the adversity of living with an incurable disease. And we provide lots of opportunity to laugh, and we provide lots of opportunity to cry, and we don't walk away from those intense emotions. We go with them and understand that people need the opportunity to be able to express the way that they feel in moving forward.
Community Palliative Care Service, celebrating life.